Okay. This is the diagnosis and investigations of HIV. Globally, the trend is towards universal HIV testing rather than testing only those patients at high risk or those with manifestation of HIV infection. However, in the UK, the testing is still targeted to high risk groups. HIV is diagnosed by detecting host antibodies either with rapid point of care tests or in the laboratory. Enzyme ELISA tests are usually done. Most tests detect antibody to both HIV-1 and HIV-2. Screening tests often include an assay for P24 antigen in addition to antibodies in order to detect patients with primary infection before the antibody response occurs. Two positive antibody tests from two different immunoassays are sufficient to confirm the infection. Nucleic acid proliferation tests, nucleic acid amplification tests, usually PCR, to detect RNA are used to diagnose infection in infant or HIV positive mother who carry maternal antibodies to HIV for up to 15 months, irrespective of whether they are HIV infected, or to diagnose primary infection before antibodies have developed. PCR is more sensitive than P24 antigen detection for diagnosing primary infection. The purpose of HIV testing is not simply to identify infected individuals, but also to educate people about prevention and transmission of the virus. Pre and post test discussions in the client home language are essential. There are major advantages to using rapid point of care HIV tests, as pre and post test discussion can be held at the same visit and ART can be initiated if the HIV is confirmed. A number of baseline investigations should be done at the initial medical evaluation. The extent of these investigations will depend on the resources available. Viral load and CD4 count. CD4 lymphocyte counts are usually determined by the flow cytometry, but cheaper methods have been developed for low-income countries. The CD4 count is the most clinically useful laboratory indicator of the degree of immune suppression. It is used together with clinical staging in addition to start prophylaxis against opportunistic infections and is of great value in the differential diagnosis of clinical problems. The CD4 count varies by up to 20% from day to day and is transiently reduced by intercurrent infections. The normal CD4 count is over 500 cells per millimeter cube. The rate of decline in CD4 count is highly variable. People with CD4 counts between 200 and 500 cells per millimeter cube have a low risk of developing major opportunistic infections, morbidity due to inflammatory dermatosis, herpes zoster or organidiasis, TB, bacterial pneumonia, and HIV-related immune disorders, ITP, becomes increasingly common as CD4 counts decline. Once the count is below 200 cells per millimeter cube, there is severe immune suppression and a high risk of AIDS-defining conditions. It is important to note that the patients can be asymptomatic despite very low CD4 count, and that major opportunistic diseases occasionally present with high CD4 counts. Viral load. The level of viremia is measured by quantitative PCR of HIV RNA known as the viral load. The determining the viral load is crucial for monitoring responses to ART. People with high viral load, more than 10,000, CD4 count မှာဆိုတော့ CD4 count က CD4 count များပဲမဲ့လေ CD4 count က250ကြာဆိုရင်သူက major opportunistic infection တွေက low risk ပဲရှိတာပြီးတော့ CD4 count များရဲဆိုရင် opportunistic infection များမှာ AIDS defining condition များလာမှာပဲဒါပေမဲ့လည်းပေါ့အဲ့လိုမျိုးဒါကတော့ချွင်းချက်တွေရှိရဲဆိုတော့ပြောတာကွာအဲ့ဒါကသူကဘာပြောရလဲဆိုတော့ patient က low CD4 count မှာလည်း asymptomatic ဖြစ်တိုင်းပြီးတော့ high CD4 count ဖြစ်နေလဲပဲ opportunistic infection ရှိနိုင်တယ်ဒါကတော့နည်းနည်း vice versa တချို့မဟုတ်ပါဘူးနည်းနည်းအဲ့လိုပြောင်းပြန်တချို့ရှိနိုင်တယ်ဆိုတော့ပြောတာကွာပြောပြီးရင်ဒီမှာအခုကဘာလဲဆိုတော့ patient က which should be offered and recommended HIV testing in the UK market. Patient assessing specialist sexual health services including GU medicine as well who attend for testing or treatment. Patient assessing primary care including emergency care or secondary care. Or patients attending their first appointment at drug dependency program IVDU pregnancy determination services treating hepatitis B or C, lymphoma or tuberculosis, lymphoma or tuberculosis, or patients who have symptoms that may indicate HIV or for which HIV is part of the differential diagnosis from a country or group with high rates of HIV infection are male or trans women who have sex with men. Report sexual contact with someone who from a country with a high rate of HIV infection. Disclose high-risk sexual partner. Disclose high-risk sexual practices. Practices is a male cancers. Okay, are diagnosed with or request testing for a sexually transmitted infection, report a history of injecting drug use, sexual partners or people known to be HIV positive or at high risk of HIV. In areas of high and extremely high prevalence, all patients not previously diagnosed with HIV who register with a general practice or undergo blood testing for any reason. In areas of extremely high prevalence, all emergency care and secondary care patients not previously diagnosed with HIV and at each general practice consultation consider offering opportunistic HIV testing. Present in inmates or new inmates not previously diagnosed with HIV. Okay. Microphone on. HIV pre and post test discussion. Pre-test discussion. Discuss meaning of positive and negative test results. Realize importance of maintaining confidentiality. Identify person to whom positive result could be disclosed. Explore knowledge and explain natural history of HIV. Discuss transmission and risk reduction. Assess coping strategy. Explain test procedures. Obtain informed consent. Post-test discussion. Test results negative. Discuss transmission and need for behavior modification. Advise second test 3 months after last exposure. Last test result positive. Explain meaning of results. Organize medical follow-up. Assess coping strategy. Stress importance of disclosure လို့ပြောရမယ်ဆိုတော့ပြောပါပြီးနောက်တစ်ခုက explain value of ART, provide written information and useful internet resources, discuss confidentiality issues, organize emotional and practical supports, names, phone numbers, facilitate notification of sexual partners. So baseline investigation, CD4 count, viral load, hepatitis B surface antigen, hepatitis C antibody, liver function test, full blood count, urine analysis, serum creatinine, syphilis serology, cervical smear in women, serum cryptococcal antigen, if CD4 less than 100, tuberculin skin test or interferon gamma release assay, sexually transmitted infection screen. ဒါကခုနအဆက်ပေါ့နော် Other experience more rapid declines in CD4 count, while those with low viral loads less than 1,000 copies per ml usually have slow or even no decline in CD4 count. Viral loads are variable. Only changes in viral load of more than 0.5 log 10 copies per ml are considered clinically significant. Okay.